Yeah, Lori and Jerry, we know that neither of the people who died was vaccinated, but we still don't know their ages or backgrounds. The governor today raising a lot of concerns about vaccination rates, pointing to how here in Lancaster County only 87% of incoming kindergartners were fully vaccinated, at least to the adequate levels for measles. He said that shows that there's a need for more protection in the community.
This disease does not respect county lines or religious lines.
Governor Josh Shapiro says there have been nearly 400 measles cases this year in Pennsylvania, touching 29 counties overall. Dr. Jeffrey Martin with Penn Medicine Lancaster General Health says the kind of spread we've seen across the state and locally could have been preventable with higher vaccination rates.
If we had community immunity, or otherwise known as herd immunity, of 95% of the population, then measles would not have gotten a foothold within Lancaster County.
Shapiro said he had a conversation with U.S. Health and Human Services Secretary Robert F. Kennedy Jr., in which he said the secretary promised support, though Shapiro felt his Department of Health is able to manage the outbreak. The Centers for Disease Control and Prevention said in a statement that it is working closely with state and local health departments to strengthen response efforts, rapidly support affected communities across the state, and communicate the steps people can take to slow the spread of measles. The MMR vaccine provides the most effective protection against measles and helps prevent its spread. But Shapiro said rhetoric on vaccines from the Trump administration and shifted recommendations on vaccines for children have been obstacles in stopping the spread of measles.
Sharing conspiracy theories and misinformation does not help the cause of public health. And it leaves people less healthy and less safe, and it leaves parents in a position where it's harder for us to do our jobs to protect our children.
Now, a spokesperson to the CDC did not specifically respond to those comments by the governor. They had previously pointed to that statement that I shared in part earlier in the story. We should also note the wording from the state on this, measles-associated. When we reached out to Lancaster County's coroner, he told me over the phone at this point they don't have any deaths where measles was the underlying cause, though he noted if the death happened in another county, he might not know about it. He also noted that certainly these are cases where people may have had measles when they died. Either way, we'll continue to follow the stories about this outbreak as it continues. But for now, here in Lancaster County, Tom Lehman, News 8.